It's lower back and hip today. It's Tuesday evening, so come and line your backs. So sorry about that, guys. Right. So start with your feet hip distance apart. Okay. So we're going to work on connection first of all. So we're wanting to feel the connection underneath both our feet, underneath the lumbosacral junction, underneath the TL junction, both shoulder blades and the back of the head. So we'll start at our feet, so we're going to try and get better connected here. So we're just going to shift the weight from side to side. So we want to create some balance between the left and right foot. So shift the weight until you can feel that you've got equal pressure underneath both your feet. Then you want to think about where you're feeling that pressure on the foot. Is it on the outside or in the inside? So if you're feeling it more on the outside, you're going to try and pull the inner arch down towards the floor. And then if you're feeling it on the inner arch, try and pull the outer arch down on the floor, but you're going to try and keep the opposite side down on the floor as well, so we're keeping the ankle in a neutral position. Okay, so once we've got that, we're going to work our way up to the lumbosacral junction. So you're going to start to tilt the pelvis forwards, so we're lifting the spine away from the floor. And then we're going to go the opposite way with the pelvis, so we're lowering the spine down towards the floor, and then tilt the pelvis away, so we're lifting the spine up, so we've got that gap between our spine and the floor, and then reverse peel the spine into the floor, just rocking backwards and forwards. And then we want to stop in the midpoint between the two end ranges. So your lower back should be nice and flat on the floor. There shouldn't be any gap. And equally shouldn't be caved into the floor. So once we've got the neutral spine, neutral pelvis, the lumbosacral junction should be feeling better connected. We're going to work our way up to the TL junction. So think of your ribs and pelvis like the pages of a book. We want the pages to be closed. So we're pulling the ribs towards the pelvis so that they're nice and parallel. So that when we breathe, the diaphragm and pelvis can communicate properly. So we're trying to get away from this rib flared appearance and this lumbar extension. So we're going to close the book, pulling the rib cage down, and you should feel better connected with the floor now between your TL junction and the floor. Then we'll work our way to the shoulder blades. So again, we want to feel that balance between the two, so we're just going to shift the weight from side to side until we can feel more balance, so that we can feel that weight equally underneath the left and right shoulder blade. And then we're thinking about the shoulders themselves, so make sure they're not up by your ears and forwards. So we're going to pull them into slight retraction. So we're pulling them backwards towards the floor. Externally rotate the shoulders and then pull them down to the back pockets. And then we're going to work our way up to the head. So the head wants to push straight back down towards the floor. So we're activating through these muscles at the front of the neck. Try not to let the head tilt backwards and try not to let it tilt forwards. So this is the position of your pelvis, your lower back, your shoulders and the neck that you want to try and maintain throughout the flow. Okay, so put one hand on your chest, one hand on your tummy. And we're just going to focus on getting the breath in the right order first of all. So as we take a breath in, the hand on the tummy is going to lift, and as you take a breath out, hand on the tummy is going to lower. So use it as a bit of a meditation, so we're just trying to switch the brain off from everything else in the world, so we're just focusing on the breath. Breathe in through your nose, out through your mouth, through pursed lips, like you're blowing through a straw. So the tummy's lifting on the breath in and lowering on the breath out. Okay, so once we've got that breath in the right order, put your hands around your waist, so fingertips in the front, thumbs in the back. And we want to try and think about now creating that 360-degree breath. So as we breathe in, all the muscles underneath the hands are going to expand and lift outwards. So the fingertips at the front are going to lift towards the ceiling, the web of the hands are going to push outwards, and the thumbs are going to push down towards the floor. Same time, think about the pelvic floor. As we breathe in, the pelvic floor is going to push downwards, it's going to go in the same direction as your diaphragm. And you want to feel this equal from side to side and equal from front to back. So it should be a nice, smooth, fluid movement, 360 degrees, all the way around your abdomen. So if there's a little bit that you're struggling to inflate on, so my side's my right side that I struggle with, so concentrate on that side, give it a poke, give it a prod, cough if you need to, so you can feel that activation. And breathe and expand. Okay, so now we've got the breath, 360-degree breath. We're going to work on the brace, so we don't want to clench or tense the belly button in towards the spine. We're going to do an outward expansion and an outward push. So we're breathing in 360 degrees, and then before you take your breath out, we're going to create that outward push, so that feeling that you create when you're about to fart, you're going to create that feeling. And try not to let the muscles expand and relax as you're breathing out. So we're going to keep a bit of tension, outward tension, in the abdominal wall as you're breathing out. Now try and keep that on the breath in and out. Breathe in, expand. Breathe out, keep those muscles active. So throughout the flow, we're going to work on our 360 breath. So we're always trying to think about your breath. And then when we're doing stuff that needs more stability, you're going to create your brace. Okay, so let's start with just doing some hip flexion. So with one leg at a time. So we're going to lift one leg up into the air. And lower, and then lift the other leg, and lower, really controlling this movement so it's just coming from the hip. So we're going to use our breath to control that movement, so we're not letting the pelvis tilt, we're not letting the spine bend. Creating nice, smooth, gliding movements with the hips. Okay, Okay, so now we're going to lift both the legs. So we're going to create the 360 breath, create the outward brace, the outward push, and lift both legs up into the air. Really try to concentrate not to let the pelvis tilt forwards as we're lifting the legs. So we don't want that lumbar extension, we don't want that anterior tilt, we're trying to keep the pelvis and lower back where it is. So really focusing on that breath. Lifting and lowering. As you're lifting your legs up into the air, try and create that external rotation in the hip. So hip flexion is always a coupled movement with external rotation and abduction. So we're going to try and create that external rotation as we lift, and then that internal back to neutral as we lower. And then we're just going to lift, hold them in the 3-month supine position. If you need to, you can just rest your legs up onto a ball or onto the sofa and just work on focusing on that breath and feeling that expansion into the lower back muscles. So feet in neutral, so ankles and feet neutral. Feet higher than the knees, knees over your hips and hips externally rotated and in slight abduction as well, so their knees are wider than the hips. Really concentrate on feeling that breath into the back, on the breath in. If you can, grab hold of your feet with your hands. And we want feet up towards the ceiling. And we're just going to work on our breath in this position. If you can't get your hands around your feet without kind of going into this neck extension and shoulders shrug, then just go back into the 3-month supine. And we're just holding it here, focusing on the breath, feeling that stretch in the lower back. It'll stretch a bit more when we take the breath in. One more breath. Legs back down. Just give your knees a little bit of a break, bring your knees to your chest, so you're just relaxing your hip flexors. Give your knees a little rock side to side as well. And then we're going to go back into the 3-month supine. And we're going to do some hip extensions. So we're going to take one leg out, but then instead of bringing it straight back up, you're going to bring it round to the side and up into the middle again. So we're sort of rotating that hip. So we're extending and then out to the side to drop the knee outwards, and then rotate it all the way back up into that 3-month supine, and then taking it out to the side, really trying to feel that movement in the hip. Again, we want to keep the lower back completely neutral and the pelvis neutral, so if you're struggling with this, you could maybe just drop one leg down and do hip extension on one side, and then alternate to the other side if you need to. So never compromise your position. Only ever do what your body is capable of in a good position. And then you can reverse it. So you're going to drop your leg out to the side and back into hip extension, and then up into flexion. Drop the opposite leg out into hip extension and back into flexion. Take the other leg out to the side. You probably find one leg easier than the other to control. Let's do one more each side. Okay, hug your knees in again, give your hip flexors a rest. Back into 3-month supine, and we're just going to do a little bit of rolling, so fingertips up to the ceiling, lift the head slightly, look to the left, roll to the left, nice and controlled, and then roll back onto the other side. Making sure shoulders and pelvis move at the same time so we're not getting that disconnection, and making sure that the spine is nice and straight as we go so we don't end up with a banana spine. Do one more each side, and then come up into lower oblique sit. And then what we're going to do is we're going to start with just some hip rotations. So we'll just concentrate on creating that internal rotation on the hip, and then external rotation. Keeping that shoulder nice and active, don't let it pull forwards, so we're activating through the shoulder girdle, folding on the hip. And then what we want to do is we're going to fold, and then we're going to come up, straighten the top leg out and lift. So we're pushing the bum off the floor, lower, bring the leg back and fold. And then up, lift, bring it back, fold, lift, do one more, lift, and then come up into the high oblique sit, and again we're just going to fold again. And then take one leg out, and you're going to lift and fold, lift, fold, lift, fold, one more. So you'll feel that in that bottom bum cheek. And then we're going to do some, so we're going to hinge forwards and lift, and then slowly lower down, rotate the hips round into your tall sit, into the opposite side and lift. Rotate round. So alternating sides. Feeling that rotation in the hips as you go. Make sure you end up in a tall sit in the middle so you're not slouched. So move over a bit and move out of the camera's way. And then we're going to come over to the opposite side, down into the lower oblique sit, and we're going to fold again, so folding on that opposite hip. Feeling that movement, feeling the internal rotation, external rotation in the hip. And then we're going to fold, straighten the leg and lift. Fold, straighten the leg, lift, fold, and try and keep the spine really straight as you're doing it. Try not to let just your body collapse. Last one. And then come up into high oblique sit, so hand on the floor. Again, we're going to start with just folding. And then we're going to fold and lift. Fold. Lift. So with this one, you don't need to straighten the leg out. You can keep it here. So fold and then lift. Or if you want to, you can straighten the leg. That's fine. Just start to feel that in your bum. Just do one more. And then we're going to come up into oblique sit, twist round into your tall sit. Okay, so we're going to go between a tall sit with a nice straight spine, and then we're just going to curve the spine, feel that stretch, and then sit back upright, so nice long spine. So when you're going backwards, try and bend the spine so it's rounding off. Yeah. And then come back up into a nice tall sit. And bend. Feel that stretch down the spine. And up. Lovely tall sits. One more. And then you're going to straighten one leg and bend the other in this position. So try and keep a nice upright spine. And then what you're going to do is alternate legs. So straightening one leg. I'll turn this way so you can see me. So from this position, then swap sides, and swap sides, swap sides. Keeping that nice tall spine as you're doing it. So it's not that easy to do it on my floor, so I'm going to go back to my mat. I think it's a bit easier to do on carpet actually. Just do a couple more each side. Okay, then we're gonna do some like glute lifts. So put your hands behind you and you're gonna put your fingertips pointing towards your bum, because it's a bit more difficult doing it the other way. And we're just gonna lift the bum in the air and lower. And lift and lower, lift, lower, make sure your shoulders feel okay doing this. Just do a couple more. Really focus on squeezing your bum together as you come up. Okay, so we'll come down, come back into your oblique sit, and then we're going to bring the hand around, so put one hand down, bring one leg round into your tripod. Okay, so we're just going to hinge the hip backwards and up. Really trying to focus on that nice neutral pelvis and not rounding the lower back as we shift the weight backwards. Focus on your breath as you're doing it. Only go as far back as your back knee will allow. Don't sort of put too much pressure on it if it's sore. Okay, and then we're going to curl the back foot under. And from this tripod, we're just going to lift the back knee off the floor and lower. And lift and lower, lift, lower, lift, lower. Let's do a couple more. Up into high kneel. Again, we're going to do some hinging, so we're hinging backwards. You feel that stretch down that leading leg, back of the leg, down the hamstring. Again, keeping the spine nice and long, so don't let your spine flex and round. Again, only go as far back as that back knee will allow you to go. Very nice. And then come up into your high kneel, pelvis level with the floor. Knee, foot not too narrow, so we're coming out to the side. Pelvis parallel, neutral spine. And we're just going to do some standing, so lean into it, into the front leg and stand. Knee tracking second and third toe. So as we take that back leg back, reset, make sure your pelvis is level with the floor. As we go down, reset again, neutral spine. So we'll do 5 on this leg. Try not to let your knee collapse as you're going downwards and as you're coming upwards, so try and keep that knee out. Last one. And then from this position, so instead of doing what we normally do and coming all the way up and round, we're just going to twist the hips into like a sumo squat sort of, and then twist round, if that makes sense. So we're going round from the high kneel into the middle, so we're really getting a nice mobilisation through the hip. So nice deep position. And then just do one more to finish on the opposite side. And then we're going to do some tripod again. So tripod hinge. Try and lengthen through the upper back. Don't let the lower back curve as we're coming back. Breathe into it, 360 breath. And just feel your hips opening up as you're doing it. Just do a couple more hinges. Then curl the back foot under. Lift the knee and lower. Lift, lower, lift, lower. Just do a couple more. Up into your high kneel hinge. Get a nice long spine as you're doing it. Very nice. Okay. From high kneel, we're going to stand. We're going to do 5 high kneel to stands. So pelvis level every time. Foot not too narrow, so bring it to the side. Knee tracking second and third toe, lean into it and stand. Lower. Control that movement, make sure the knee's not coming in. Better, nice. Ooh. Make sure you don't lose your balance on the way back down. Do one more. Knee, good. Slowly, slowly, slowly down. Okay, so from here, put the hands down. Take that front leg back. Down into quadruped. Down into low quadruped. And we're just going to come into a bit of a prayer stretch. And just focus on the breath. So breathe 360 degrees. Feel that stretch in the lower back. One more breath. Come up again into low quadruped and then into quadruped. Find your neutral spine, upper back nice and long. We're going to do some hip hinging, so we're hinging backwards, keeping that lower back neutral and pelvis neutral, so this movement's coming from the hip, not from the lower back, and then coming out, so extending through the hip, not through the lower back, and back, forwards, back, forwards, back, forwards, one more, and then what you want to try and do now, we're going to try and coordinate, do a little bit of coordination. So you want to take one leg and one out, arm out to the side. So transfer the weight, if you're taking your right arm out and your left knee, you want to transfer your weight into the left hand and right knee. You're going to take your leg and arm out, and then you're going to bring the arm forwards and the leg backwards, and then bring it back into the middle. Take the opposite arm, opposite leg out, and then arm into flexion, leg into extension. So let's just see how you do with those. So does that all make sense? So you take one arm, one leg out to the side, and then, okay, and then bring it back in. Yeah. So if you go, so take the arm out to the side and the leg out to the side first. So not backwards. So it's like cocking your leg, yeah, and taking the arm out. And then from there, you want to take the leg back and the arm forwards. And then back into the middle. Good, nice, lovely. You okay with that one, Dawn?
I'm not sure.
Let's have a look. It looked like you were doing alright. So you guys keep going with this.
On the same side?
So opposite sides. So you take one arm, one leg,
Yeah.
and then back, and then in. And then you go the other way, and back. Very nice. Lovely. Perfect, yes. And controlling the lower back as you're doing it, and pelvis. Keeping the spine still, so this movement's just coming from the extremities. Just do a couple more each side. Okay, and then we're going to go from quadruped into bear. So we're going to find neutral, make sure we've got a nice long upper back, lift the bum in the air. And then we're just going to hinge the hips backwards and come forwards. And hinge. And forwards. Hinge. Forwards. And then we're just going to hinge backwards. Walk the hands back into your squat. Make sure you've got your nice long spine, so we're not rounded. So nice straight spine. Twist the hips, so one knee down to the floor. Really open out your hip, so use your arm to open it out. And then come back into your squat and then twist the other way. So use your arm to stretch you out. And back, round again. back, round. Do one more each side. Feel that stretch. Back into your squat. Stand. And we're just going to do a few squats. So get your feet at your comfortable distance apart. Neutral spine. Neutral pelvis. Get your breath. And squat. Nice and upright spine. Keeping control of your pelvis. Really good. They're lovely squats. And up. Down. And up. So do 5 of these. Keeping control of your pelvis. One more. Lovely. Fabulous. Right. Well done for today.